Two injections. Both involve a needle. Both can help with heel pain, but they work in completely different ways, and understanding the difference could save you from months of unnecessary pain and potentially harmful treatments. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas, where I've been helping patients overcome chronic foot and ankle pain for over 25 years. Today, we're going to settle this once and for all. When should you choose cortisone, and when should you choose PRP? And why one of these treatments might be actually making your problem worse. Before we get started, please take a moment to like this video, hit the subscribe button, and share it with anyone who's been told they need an injection for their heel pain. This information can change the course of their treatment. Here's the key question that most patients never get a clear answer to. Do you want temporary pain relief, or do you want actual healing of the plantar fascia? Because that's really what we're talking about here. These aren't just two different medications, they're completely different philosophies of treatment. One is designed to mask your symptoms quickly, the other is designed to actually repair the damaged tissue that's causing your pain. And here's what's concerning. Many patients are getting the wrong injection for their situation simply because the doctor reaches for what's familiar, what's covered by insurance, or what provides the fastest relief. Let me give you a quick refresher on what's happening when you have plantar fasciitis, because understanding this will help you make the right choice. The plantar fascia is a thick band of tissue that runs under the bottom of your foot, from the heel bone to your toes. When this tissue becomes inflamed, develops tiny tears, or degenerates over time, you get that stabbing heel pain that's the worst when you first step out of bed in the morning. Now here's the critical point. There are different stages of plantar fasciitis. In the early stages, you might have an acute inflammation that responds well to anti-inflammatory treatments. But in chronic cases, especially those that have been going on for months or years, you're dealing with the tissue degeneration, not just inflammation. This is where the choice between cortisone and PRP becomes crucial because they address these two different situations in completely different ways. Let's start with cortisone because it's what most people are familiar with. I like to think of cortisone as a fire extinguisher for inflammation. Cortisone is a powerful synthetic steroid that mimics a hormone when your body naturally produces. And when we inject it into inflamed tissue, it works incredibly fast. We're talking about pain relief that can start within hours and reach its peak in a few days. Here's how it works. Cortisone suppresses your immune system's inflammatory response. It essentially tells your body to stop sending inflammatory cells to the area, which reduces swelling, heat, and pain dramatically. And I want to be clear, cortisone can be remarkably effective for the right patient at the right time. I've seen patients walk out of my office pain-free after months of agony. When you're dealing with acute inflammation, cortisone can provide the relief you need to get back to physical therapy, proper stretching, and addressing the underlying cause of your heel pain. But here's where things get complicated. Cortisone is like using a fire extinguisher on that house fire. Yes, you've put out the fire, but you haven't repaired any of the damage the fire caused. The charred beams, the damaged foundation, the weakened structure, none of that gets fixed. This is what I call the cortisone trap, and I see patients get caught in it all the time. Your first cortisone injection works beautifully. You get 3 to 4 months of relief, maybe even longer. You think your plantar fasciitis is cured, but then the pain comes back, often just as severe as before. So you get a second injection. This time, you might get 6 to 8 weeks of relief. The third injection, maybe a month. Each injection becomes less effective and lasts for a shorter period of time. Why does this happen? Because cortisone doesn't heal the underlying tissue damage. Those microscopic tears in your plantar fasciitis are still there. The degenerative changes that develop over months or years of chronic inflammation haven't been addressed. Even worse, repeated cortisone injections can actually weaken the plantar fascia. Studies show that multiple steroid injections increase the risk of plantar fascia rupture. That's why most doctors limit you to 2 to 3 injections per area per year. But there's another problem with cortisone that many patients don't realize. When it's suppressing your inflammatory response, it's also suppressing the healing response. Inflammation, when it's controlled and appropriate, is actually necessary for tissue repair. By shutting down inflammation completely, cortisone can interfere with your body's naturally healing processes. Now let's talk about PRP, Platelet-Rich Plasma, which takes a completely different approach. PRP harnesses the healing power that's already flowing through your veins. We draw a small amount of your blood, spin it in a centrifuge to concentrate the platelets, and inject this concentrated healing solution directly into your damaged plantar fascia. But platelets do much more than just clot blood where you're getting injured. They're packed with growth factors, specialized proteins that signal your body to send repair cells to an injured area, simulate the formation of new blood vessels, and promote the growth of new healthy tissue. Here's the key difference. Instead of suppressing your body's response to an injury like cortisone does, PRP enhances and amplifies your natural healing processes. Think of it this way. If cortisone's like putting out a fire, PRP is calling a construction crew to rebuild that house stronger than it was before. When we inject PRP into your damaged plantar fascia, we're delivering a concentrated dose of the same growth factors your body would naturally produce, but in quantities sufficient to restart and complete the healing process that's stalled. Let me explain exactly what happens when PRP goes to work in your plantar fascia. First, those concentrated platelets release growth factors that signal your damaged tissue to begin repair. They're essentially sending out a call for help, recruiting stem cells and other repair cells to the area. Second, PRP stimulates the formation of new blood vessels. This is crucial because the plantar fascia has a relatively poor blood supply, which is one reason why plantar fasciitis can become chronic. By improving blood flow to the area, we're ensuring that nutrients and oxygen can reach the healing tissue. Third, PRP promotes the production of new collagen, the protein that gives your plantar fascia its strength and flexibility. Instead of weak scar tissue, your body produces new, healthy tissue that can function normally. This is why PRP results take longer to appear than cortisone results. We're not just masking symptoms, we're actually rebuilding damaged tissue, and that takes time, usually 4 to 8 weeks, to start seeing improvement, with continued progress over several months. But here's what's exciting. Because we're actually healing the underlying problem, the results tend to be much more durable. Many patients experience relief that lasts for years, not months. Now, I know that some of you might be thinking, that sounds too good to be true. Where's the evidence? The research on PRP for plantar fasciitis is compelling. Multiple studies have shown that PRP provides significant improvement in 70 to 80% of patients with chronic plantar fasciitis, with results that are maintained long-term. One study, published in the Journal of Foot and Ankle Surgery, compared PRP to corticosteroid injections and found that while cortisone provided faster initial relief, PRP provided superior results at 6 months and beyond. Another study followed patients for 18 months and found that PRP not only reduced pain more effectively than cortisone in the long term, but also improved function and quality of life measures. What's particularly interesting is that PRP seems to work best for a patient who needs it most, those with chronic degenerative plantar fasciitis who haven't responded well to conservative treatments. Now, despite everything I've said about the limitation of cortisone, there are still situations where it might be the right choice. If you have acute plantar fasciitis, meaning it's been going on for just a few weeks, and you're dealing with significant inflammation, cortisone can provide the rapid relief you need to get back to proper treatment. If you have a major life event coming up, or maybe you're walking your daughter down the aisle next month, or you're training for a marathon and the race is next week, cortisone might give you a short-term relief that you need to get through that important moment. If you have severe end-stage plantar fasciitis that's already scheduled for surgery, cortisone might help manage your pain while you wait for the procedure. But here's the key. Cortisone should be viewed as a bridge, not a destination. It's a tool to get you through a specific situation, not a long-term solution for chronic heel pain. PRP, on the other hand, is ideal when your goal is actually healing rather than just symptom management. You're a great candidate for PRP if you've been dealing with plantar fasciitis for months or years. If you've tried conservative treatment without lasting success, or if you want to avoid surgery, or if you've already had cortisone injections with diminishing returns. PRP is particularly valuable for patients with chronic degenerative plantar fasciitis. These are cases where the tissue has been damaged for so long that your body's natural healing processes have essentially given up, and PRP can restart that healing process. I also recommend PRP for active patients who want to return to sports or high-impact activities. Because PRP actually strengthens the plantar fascia rather than weakening it, you can return to full activity with confidence once the healing is complete. Let me walk you through what to expect with each treatment because the experience is quite different. With cortisone, the injection itself might be uncomfortable, but many patients feel relief within hours. You might have some soreness at the injection site for a day or two, and you typically feel dramatically better. The challenge is that this relief is temporary. With PRP, the injection process is similar, but the recovery is different. Because PRP works by stimulating an inflammatory healing response, you might actually feel worse for the first week or two after the injection. This is normal and actually a good sign. It means the PRP is working. Most PRP patients start noticing improvement around 4 to 6 weeks, with continued progress over the following months. The key is patience. We're rebuilding tissue, not just suppressing symptoms. I know cost is a factor for many patients. Cortisone injections are typically covered by insurance and cost very little out of pocket. PRP is usually not covered by insurance and can cost several $100s. But here's how I encourage people to think about it. What's the true cost of your heel pain? If you get cortisone injections every few months for years, those costs add up. More importantly, what's the cost to continue to live with chronic pain? What activities are you missing? How is it affecting your quality of life? When you factor in the potential to avoid surgery with all its associated costs and recovery time, PRP often represents significant value both financially and in terms of your long-term health. So how do you decide which injection is right for you? Ask yourself these questions. How long have you been dealing with heel pain? Have you tried conservative treatments? Are you looking for quick relief or long-term healing? Have you already had cortisone injections that provide diminishing returns? If you've been dealing with chronic plantar fasciitis for months or years, if conservative treatment haven't provided lasting results, if your goal is to actually heal the problem rather than just manage symptoms, PRP is likely your better option. If you need rapid relief for a specific situation and you're dealing with acute inflammation, cortisone might be appropriate as part of a comprehensive treatment plan. Here's the bottom line. Cortisone and PRP aren't just two different medications. They represent two different philosophies of treatment. Cortisone is about symptom management. It's powerful, it's fast, and it can provide dramatic relief, but it doesn't heal the underlying problem, and repeated use can make the problem worse. PRP is about regenerative healing. It takes longer to work, requires patience, and costs more upfront, but it addresses the root cause of your pain and can provide lasting relief by actually repairing damaged tissue. The choice between them should be based on your specific situation, your goals, and your timeline. But interestingly, as we understand more about the limitations of cortisone and the benefits of regenerative medicine, the PRP is becoming the preferred option for patients with chronic plantar fasciitis. I can tell you that patients who do the best long-term are those who choose treatments that actually heal their condition rather than just mask their symptoms. If you're struggling with chronic heel pain, if cortisone shots aren't working like they used to, or you're looking for a treatment that actually heals rather than provides temporary relief, I encourage you to learn about PRP. Call our office and mention this video. We'll do a thorough evaluation, discuss whether PRP is right for your specific situation, and create a treatment plan that's designed to get you back in the activities you love. Please take a moment to like this video. If it was helpful, subscribe to the channel so you don't miss future videos about advanced heel pain treatments. And share them with anyone you know who's been struggling with chronic plantar fasciitis. Remember, you have options beyond just managing your pain. There are treatments that can actually heal your condition, and we're here to help you find them. Thanks so much for watching, and have a great day.